We know a number of children are still in a hospital tonight, and so is the suspect's grandmother.
Just in the last few hours, University Health gave an update on 4 victims they're treating here in San Antonio. KENS 5 reporter Matt Houston is there now. Matt?
Deb, doctors tell me they expect each of those 4 patients to survive their injuries. That is significant because these were the 4 most severe or urgent cases rushed to San Antonio on a hospital tonight, on a helicopter. Tonight, officials tell me they knew how to save these victims' lives because of lessons they learned after Sutherland Springs.
University hospital surgeons call the victims' wounds destructive, and some will need more operations.
The road to recovery for these patients will be long.
But Dr. Lillian Liao says yesterday's life-saving surgeries were successful, thanks in part to care first responders provided each patient before they reached San Antonio.
And the reason why we feel like we have survivors from this incident related to what we learned from Sutherland Springs. Unfortunately, we learned from Sutherland Springs.
Nearly 5 years ago, community leaders asked how they could have saved those victims who didn't make it to a trauma center. Now, San Antonio is one of only a few cities in the world that provides patients with whole blood transfusions before they reach the hospital.
And you can bleed to death in as little as 5 minutes. So to be able to have that blood to replace immediately before they get to a trauma center is important.
Responders in other cities usually wait to separate platelets from plasma, in part to cut waste. But the raw mixture works in a crisis. Almost as soon as this need became obvious, blood was on a helicopter, and Uvalde wasn't alone.
You heard from Chief Hood a moment ago. He brought up whole blood in his interview with Deborah as well. He said that probably would have saved some lives in Sutherland Springs. Since that tragedy, community leaders also pushed for a new law that sort of boosts education and training on blood loss prevention. Sure enough, each of the victims from the Uvalde incident arrived here in San Antonio with a well-tied tourniquet that helped stop the bleeding. We're live in the medical center. I'm Matt Houston, KENS 5.
Thank you, Matt.